Andrew Reinhardt joining me now. He's a medical technician from Wasatch Medical Clinic, and he's here to tell us about a breakthrough solution for erectile dysfunction. What is this new treatment?
This new treatment is called acoustic wave therapy. Uses a device, FDA cleared by the way, that will open up the blood vessels, increase blood flow. So if you think about erectile dysfunction, everybody has treated this with medication, which is kind of a Band-Aid. This is the first thing that treats the root cause of the problem, blood flow. That's really what this is a lack of blood flow.
So why do you call medication a Band-Aid? What's not working there?
Well, it works temporarily for some. For almost all, it comes with nasty side effects. The headaches and the blurred vision. And guys taking the pill, they know what I'm talking about. They have to pre-plan. They deal with that hangover feeling the next day. And all of them say, I used to just not have to think about it. It used to just work, and I want to go back to those days.
This technology is tiny enough to bring into our studio.
Yeah.
How does it work exactly?
It's placed on top of the skin. It has a ballistic movement that delivers pulsating waves into the tissue, causing the blood vessels to regrow and widen, which increases blood flow when the timing's right, of course.
How successful is the treatment?
We have about an 85% success rate. And what's interesting is younger guys, older guys, despite health history, we have guys that come in that say, I'm a diabetic, it won't work, or I have prostate issues. Despite all of those health concerns, it works at about an 85% rate.
How many treatments does it take to see results?
Typically, a guy will do a few treatments, I'm kind of guessing, a few treatments in a 2 to 3 week period. I like that because by the end of August, think of that, you can be back to normal function in the bedroom. It's not something you have to repeat on an ongoing basis.
Who are we talking to right now? Who is this for? Who's calling in?
Well, a lot of guys struggling, and they're kind of apprehensive and embarrassed, and a lot of spouses we're noticing also. The spouses call in and say, my man has an issue, and I'd like to get it fixed, which I think guys say, oh, no, I'm embarrassed, but it's kind of a compliment if you think about it when, your partner wants to get things going again.
What's that conversation like for the gentleman walking into the clinic?
I'm shocked that a lot of men bring their spouses with them, which I think is really cool. It's kind of a, it's a decision between the two of them, and they always come in a little bit apprehensive, but I think you'll be comfortable. We've treated hundreds, maybe thousands of patients now with very good success.
Well, intimacy is so huge, such an important part of every relationship. You have another location now.
We do. So we're in Murray. We also have St. George. So if you're in southern Utah and you'd like to get in for an assessment, give us a call.
Should you call first to get information just if you have any questions, or should you make an appointment?
Well, call in, and getting in for that assessment with the doctor is the best way for the doctor to say, okay, this is your situation. This is why you have ED. Everything is so specialized and custom. That's the best way to get them.
I know you have something special for our viewers watching right now.
We do. So that free assessment, that exam, that blood flow ultrasound for anybody that calls in right now, that's done by a medical doctor.
Well, I'm looking at the bottom of the screen because that's the phone number, everybody. 801-901-8000. Wasatch Medical Clinic, 2 locations now. I love that you're in southern Utah. For everyone down there watching in southern Utah, abc4.com/midday, and we will link you to the Wasatch Medical information. Andrew, thank you so much, and we'll be right back with your Pinpoint Forecast.